Good morning. I am Dr. Simpiwe Siko. Today we are talking about hypertension. But before we continue, don't forget to like and share the video. Also click on the subscribe button below and switch on the notification bell so that you can be notified when I upload more videos in the future. In this video, we will cover the definition of hypertension, classification of hypertension, how to measure blood pressure correctly, lifestyle changes to reduce hypertension, and drug treatment of hypertension. Hypertension is defined as the persistent blood pressure of 140/90 millimeters mercury or higher. These are the guidelines for correctly measuring blood pressure. The patients must at least sit for 3 to 5 minutes before the blood pressure is measured. Take at least 2 blood pressure readings in both arms. Use the arm with the highest blood pressure readings as the baseline. The patient must be in a relaxed position. 30 minutes before the blood pressure is measured, the patient must not smoke, consume caffeine, and must not eat any food. Use the correct cuff size. A standard cuff of 12 cm for a normal arm and a larger cuff of 15 cm for an arm with a mid-upper circumference greater than 33 cm. The bladder within the cuff should encircle 80% of the arm. In people of risk of orthostatic hypertension, such as the elderly or diabetic patients, remember to also take the blood pressure in a standing position. Systolic blood pressure is measured at first appearance of sound, that is correct cough 1, and diastolic blood pressure is measured at the disappearance of sound, that is correct cough 5. Take repeated readings in patients with dysrhythmias, such as atrial fibrillation. This table shows the classification of hypertension. Grade 1 hypertension is a systolic blood pressure of 140 to 159 millimeters mercury and a diastolic blood pressure of 90 to 99 millimeters mercury. Grade 2 hypertension is a systolic blood pressure of 160 to 179 millimeters mercury and a diastolic blood pressure of 100 to 109. Grade 3 hypertension is a systolic blood pressure of 180 and higher and a diastolic blood pressure of 110 and higher. Isolated hypertension is a systolic blood pressure of 140 millimeters mercury and higher, but with a diastolic blood pressure of 90 millimeters mercury, that is below 90 millimeters mercury. The goal of treatment for hypertension is a blood pressure below 140/90, irregardless of cardiovascular risk factors and underlying comorbidities. An exception is made for patients over 80 years of age, where therapy should be initiated if systolic blood pressure is higher than 160 millimeters mercury, and the goal of treatment is to keep systolic blood pressure between 140 to 150 millimeters mercury. Treatment of hypertension includes lifestyle modification and drug treatment. Lifestyle modifications to reduce hypertension are weight loss, DASH diets, dietary sodium, physical activity, alcohol moderation, and tobacco cessation. The patient must maintain a normal BMI. Weight loss reduces systolic blood pressure by approximately 5 to 20 millimeters mercury per 10 kg. Dietary approaches to stop hypertension, also known as DASH diets, involve reducing saturated fats and total fats, eating more fruits, and eating more vegetables. DASH diet reduces systolic blood pressure by 8 to 14 millimeters mercury. Salt, and more salt. Dietary sodium that a person consumes a day should be less than 100 millimoles or less than 6 grams, which is less than 1 tablespoon. Controlling dietary sodium reduces systolic blood pressure by approximately 2 to 8 millimeters mercury. Other foods that are high in dietary sodiums are packet soups, stock cubes, gravies, processed cheese, breakfast cereals, breads, salty snacks, and tinned foods. Regular moderate exercise is advised, for example, brisk walking for 30 minutes per day on most days. Regular moderate exercise reduces systolic blood pressure by 4 to 9 millimeters mercury. Alcohol should be limited to a maximum of 2 alcohol drinks per day. But the question is, how much is one drink? One drink is equal to 340 ml of a 5% alcohol beverage, 142 ml of a 12% alcohol beverage, and 43 ml of a 40% alcohol beverage. Reduction of alcohol intakes reduces systolic blood pressure by 2 to 4 millimeters mercury. Patients must be advised to stop smoking completely. We are now going to look at the treatment of hypertension using medication. There are numerous drug classes for the treatment of hypertension. We have, for example, thiazide or thiazide-like diuretics, ACE inhibitors, angiotensin receptor blockers, and calcium channel blockers. The important thing with drugs of hypertension is knowing which drug to use in a certain situation and knowing which drugs are contraindicated in certain circumstances. It is also important to remember which combinations to use and which combinations to avoid. These will be discussed in another video. This diagram shows the treatment approach according to the blood pressure. After recording the patient's blood pressure on at least 3 separate occasions, drug treatment should be considered. Grade 1 hypertension in patients with 3 or more risk factors, or diabetic, or have target organ disease or complications, is managed with lifestyle modification and then reviewed in 3 to 6 months. If the blood pressure is not at goal on review, continue lifestyle modification and start monotherapy. Grade 1 hypertension in patients with less than 3 risk factors, no target organ disease, and no complication is managed by lifestyle modification and starting monotherapy and reviewing patients in 4 to 6 weeks. If blood pressure is not at goal on review, continue lifestyle modification and add a second drug class and review the patient in 4 to 6 weeks. Grade 2 hypertension is treated with lifestyle modification, 2 drugs, and the patient is reviewed in 4 to 6 weeks. If blood pressure is not at goal at review, then optimize drug treatment or add a third drug. Grade 3 hypertension and hypertensive emergencies and also special definitions of hypertension are not included in this video. A follow-up video will discuss these topics. That concludes my talk for today. Please like, share, and subscribe. I thank you.